Hi, I'm Dr. Chuck Gbur, and I'm going to talk a little bit about permanent pacemakers. If you have certain rhythm problems that require a pacemaker, we have several different options to choose from. One would be a standard implantable device similar to this. This goes under the skin and will have several wires that lead to your heart. So typically pacemakers are put in when you have heart rhythm problems where your heart does not beat fast enough to keep up with the demands of your body. It's often used in patients that have atrial fibrillation or other slow heart rhythm problems. If you're scheduled for a pacemaker, you'll be asked to not eat anything the night before. When you arrive at the hospital, you will check in through registration and be brought to the cardiac catheterization lab. Once you're there, our recovery room nurses will admit you to the hospital, ask you questions, and prepare you for the procedure. When the time comes, you will be brought back to our electrophysiology lab, and you will be prepped with the normal drapes and so forth. That'll take about a half hour or so. And then we will give you some sedation. You'll be relaxed, but still able to communicate with me. I will usually place the device in the left chest. And to do that, I'll initially numb you up with lidocaine and then make a small incision. The wires are then put in through one of the veins that lead to your heart. Once we get the leads in position, we'll put the device into the pocket, hook them to the wires, and then close the pocket. Typically, the procedure itself takes about 45 minutes to an hour. At the end of the procedure, you'll still be a little bit sleepy and you'll be taken to our recovery area. You'll be evaluated by the nurses, and then once you're fully awake, we'll do some testing such as a chest x-ray, and also the representative from the device will re-interrogate your pacemaker. You'll be able to go home that day, but one of the important things is that we ask that you don't lift your arm above your shoulder. It's also very important not to do any heavy lifting for 4 to 6 weeks, and that also includes not driving until it has time to heal. The recovery period from a pacemaker is usually 4 to 6 weeks before you can resume full activity. If you've had a pacemaker inserted, you'll have to follow up in our office, usually in 10 to 14 days, where we can evaluate the incision. Obviously, if you have any concerns, such as swelling, pain, redness, tenderness, fevers or chills, or anything else, please contact us immediately. Once your pacemaker is implanted, we will follow up with you every 6 months in the office where we interrogate the device, make sure that the battery's working, make sure the settings are correct, and make any adjustments that may need to happen. Typical pacemakers will last anywhere from 7 to 12 years. Once your pacemaker is getting close to needing replaced, then we will start following you in the office more closely. When the time comes, we bring you back to the hospital and we'd actually replace the entire device. It's really important once you have the device in to limit your activity. Although the leads are in good position when we send you home, they haven't fully set in. So excessive movement could cause a lead to fall out of position. Should that happen, we'd have to bring you back in, open up the incision, and reposition the lead. Although rare, this does occasionally happen. In general, putting in a pacemaker is a very simple procedure, but there are associated risks. The most common is a little bit of pain and bruising around the pacemaker site. More serious risks include a possible pneumothorax, which is where when the needle goes in, it collapses the lung. Although this sounds scary, it may add a day or two to your hospitalization, but there's usually a full recovery. Like any invasive procedure, there are more serious complications, which include perforating the heart with the pacemaker leads. It could also include causing rhythm problems and even death. But although these are very serious, they're extremely rare. Although it may seem a little bit scary to have a pacemaker, it's actually a fairly simple procedure. Most people will go home the same day. You will have a little bit of limits on your activities for the 4 to 6 weeks after the device is implanted, but after that, you should be able to resume full activity. If you have any questions or concerns that I haven't covered in this video, please don't hesitate to contact me at the office.